Living with diabetes isn't just about managing blood sugar, it's about managing the emotions that come along with it. If you've ever felt frustrated, guilty, overwhelmed, or even scared about what the future holds, you're really not alone. These feelings are incredibly common, and they can be just as challenging to navigate as the physical aspects of diabetes. I'm Dr. Nerys Frater, an NHS GP and founder of the Lifestyle Clinic, and I've worked with so many people who feel like they've been carrying the weight of the world on their shoulders when it comes to their health. Maybe you feel frustrated with your progress, guilty about the choices you've made in the past, or overwhelmed by all the changes you need to make now. Or perhaps you're afraid of complications down the line and wondering if it's too late to turn things around. And these emotions are really valid, but they don't have to define your journey. One of the most important steps that I find in managing diabetes is acknowledging and accepting the emotions that come with it. Why do I say this? Well, I've seen so many people try to hide their diagnosis, sometimes out of shame, fear, or because they fear the stigma that they've caused this or brought it upon themselves. But the truth is, hiding from these feelings or pretending they don't exist can really hold you back. When you push those emotions down, they don't actually go away. They still sit in the background, quietly affecting your motivation, your mindset, and even your health. So acknowledging these feelings isn't about being weak or dwelling on the negative. It's about giving yourself the space to process what you're going through. When you face them head on, you actually take away their power and you start to see that you're not alone. There's no shame in living with diabetes. It's okay to feel frustrated, scared, or overwhelmed. In fact, the mere fact that you're watching this now shows that you're motivated to do something about it. It's a sign of strength. Yes, it's hard, but you're ready to work through it. And by bringing those feelings out into the open, you set yourself up for greater success because you're no longer carrying the emotional weight of silence. And of course, your diagnosis doesn't define you. It's not something to hide. It's a part of your story. And by accepting it, you empower yourself to take control and move forward with confidence and clarity. So many people can use this diagnosis as a wake-up call to positively improve their lifestyle. Because unlike so many other conditions, you've got power here. Yes, it's frightening, but you've got the power within you to get control back if you choose to do so. So let's start by acknowledging the emotions that so many people experience when they're living with diabetes. It's normal to feel frustrated when it seems like your efforts aren't paying off or when you're faced with setbacks. You might feel guilty about past choices, thinking, if only I'd done this differently, I wouldn't be here. Overwhelm is another big one. There's so much to learn, so many changes to make, and it can feel impossible to know where to start. And then, of course, there's fear. The fear of complications, of losing control, or of what the future might hold. So one of the most important things you can do is to practice self-compassion. So easy to be hard on ourselves. I think it's part of being human. We naturally focus on what we've done wrong or what we haven't achieved, but actually doesn't help. It only adds to the stress and makes it harder to move forward. So instead, if you could treat yourself with the same kindness and understanding and compassion you'd offer a friend, remind yourself that diabetes is complex and progress will take time. It is not about being perfect. Just make small, consistent steps in the right direction. So shifting your mindset from I've failed to I'm learning, for example, can make a huge difference. So give an example of if you had a day when you had a high blood sugar, higher than you'd like, instead of feeling defeated, ask yourself, what can I learn from this? What went wrong? Why didn't I follow the diet or whatever? Every setback is an opportunity to grow. And of course, you don't have to face the journey alone. Having a strong support system, whether it's a family, friend, a healthcare provider, or a community of people who understand what you're going through, can make a huge difference. When you've got somebody to talk to, somebody to lean on, it helps lighten the emotional load. And if you don't feel like you have the support right now, consider joining a group or a program where you can connect with others on a similar journey. That's one of the things I love most about the community we've created with the Blood Sugar Mastery Programme. It's not just about the practical tools and strategies, it's about the community, together celebrating wins, navigating challenges, and reminding each other that we're not alone. So let's talk about practical ways to manage stress and stay motivated, because emotional well-being is such an important part of living with diabetes. You could try deep breathing or mindfulness. So when you're feeling stressed or overwhelmed, just pausing, take a moment and breathe. Even just a few minutes of deep breathing can calm your mind and body. Mindfulness practices like focusing on the present moment or doing a short meditation can also help reduce stress hormones and improve your overall outlook. Make sure you set small, achievable goals. Instead of trying to change everything at once, just do one thing at once. For example, you might start by adding one extra serving of vegetables to your meals, or taking a 10-minute walk after dinner. Yes, they're small, but actually you can build momentum and it can keep you motivated because you can achieve them. What about celebrating progress rather than perfection? So every positive change, you actually acknowledge it, even if it's really small. It is a win. So, did you move your body for 10 minutes? Did you add vegetables? Focus on progress rather than perfection. Yes, so you're giving messages to your brain that you can actually do this. Another important and overlooked factor is prioritising sleep or rest. It's so important for your physical and emotional health. If you can get 7 to 8 hours of quality sleep each night, it's amazing. And don't underestimate the power of rest. Time to recharge is not a luxury, it should be a necessity. Because living with diabetes is a journey, and it's one that comes with its share of challenges, but it's also a journey of growth, resilience and transformation. If you address the emotional side of diabetes, practicing self-compassion and building a strong support system, you can navigate this journey with confidence and hope. And probably one of the biggest hurdles to overcome is actually avoiding sugar itself, isn't it? The human brain is hardwired to love sugar. If you can overcome that, you can overcome anything. And if you want help in doing that, I've created a 10-day challenge designed to overcome the sweet tooth. So click the link below if you want more information.